Hi guys, Dr. Erickson again. Let's talk a little bit more on the topic of ADD and ADHD. And as it relates to children, there is a very profound motto which we have in our clinic, and that motto is that we treat the child and not the diagnosis. Okay, labels are for cans, and they are not for kids. Unfortunately, all too often we find that children or other people are labeled with a diagnosis, and now that becomes their reality. That becomes who they are. Interestingly enough, when we look at ADHD and autistic spectrum disorders, allergies, and asthma, they all have some common threads. And those common threads are that there are metabolic dysfunction, meaning there are things within the body, mechanisms within the body that are not working properly. There are neurologic dysfunctions, meaning the brain is not online and not doing its job, and the body is struggling with toxicity. These are the common threads that can be found between ADHD, ASD, which is autistic spectral disorders, allergies, and asthma. Now, these particular situations can be overcome if you take the correct approach. And that correct approach is by balancing the metabolism, specific brain or neurological therapies, and also reversing the toxicities that the body may be experiencing. Now, often we fall back on the excuse that, well, it's genetic. It's in our genes. My mother had it, my father had it, my uncle had it, my grandfather had it, and so therefore I have it. Now, I'm not discounting the fact that genetics does play a role in many conditions that we're dealing with, but I'd submit to you that that role is more of a minor one. It is our lifestyle. It is the things that we are exposed to that allow the genetic tendencies to actually express them in our lives. Now, if you were to add together the impact, the numbers of children who have ADHD, autistic spectral disorders, which would include dyslexia, ADD as well, allergies, and asthma, it comes to a shocking 20 million kids in the United States. In other words, that's about 1/3 of all our American children are dealing with these issues. Now, if you caught what I said earlier, these can be overcome by taking the correct stage in moving, or the correct steps in moving forward. There is so much of a need for getting to the cause of problems and not just simply adjusting your dosage or prescribing a new medication. The take-home message here is that you cannot drug your child out of a metabolic or neurologic disorder. You have got to find the cause and address that. Medication has not cured anyone of ADD or ADHD. It can cover up the symptoms. Once again, you cannot drug your child out of a metabolic or neurological disorder. This is Dr. John Erickson saying have a wonderful day. We'll talk to you again.